Hey, Dr. Lindsey and Wendy here. We're going to take you right through a repair case today on a young guy. I think he's 34, right, nurse?
Yes, doctor.
And when we see this all the time, he went to a place and had a case that was sold to him based on the payment plan he could afford and the downtime he could tolerate, and it turned out to be too little hair in too little space, maybe even too much space. And as the years went by, he just looked too thin, so then he goes and gets SMP done on his head, which doesn't actually look too bad, but he comments that about half of it's faded in the first 3 months. And then what tricked us was when we looked at his donor region, I thought I could get probably 2,800 grafts, and it turned out he had his whole donor area SMP.
SMP, yeah, he had the scar too. Yeah?
And then we get that strip out of him with skinny hair, and I thought, man, we're going to be lucky to get 22, but luckily we got 2,415 grafts, which is enough to cover what our goal was today. So this video will go through step by step. So here's his introduction. All right, Michael, can I use your face on my YouTube page? Is that okay?
Sure.
How about wife? You okay?
Yes.
Okay. So Michael, how old are you? I can't remember.
34.
Chin down just a little bit, even a little farther.
Mm-hmm.
So you got a case by somebody a group that's nationwide.
Correct.
And how many years ago was that?
It was 8 years ago.
Yeah. And my complaint, and I think your complaint, is it's just not enough hair.
Correct.
And then you got SMP'd, which really hasn't lasted a whole lot.
No.
But they've already committed to this low hairline, so that's what we got to go with. And how bald was your dad or your granddad?
My dad has a full head of hair, and I'm not sure about my granddad. I wasn't born when they were still alive.
Chin down just a little more. But I mean, you got a few hairs. How many did you supposedly pay for? Do you remember?
I was supposed to pay for about $1,100, and they ended up giving me somewhere in there too. But
so $1,100, is essentially your hairline to about an inch back,
right.
And you got some grafts right here, mm-hmm. and not much over here. Spin around. Let me see the back of your head. Mm-hmm. And then when they did it, I'm not sure why anybody does this, but they did a cut on just one half of your head rather than the center. It's not a bad scar. It's not the world's best, but I think we'll be able to get at least that good and hopefully better. But you got plenty of hair. You got kind of fine hair. Chin up towards the ceiling. Yep. And you got this crown that's coming.
Yeah, I know.
So we'll do the front, fix up the front today, and wait a while. I got a few more years left in me. One of these days we'll maybe hit back here, and then who knows what happens after that. Turn back around, Michael. Wife, you got anything you want to add to that? You're a nurse, right?
Yeah, just that it just wasn't what he was looking for, so that's why we're looking for something more.
All right, and I'm relying on you, wife, to take good care of this head this week. All right. So what do you think? I mean, he's a nice enough character. His wife's a nurse, and I think they know what they're getting themselves into, right?
Yes, he was very hesitant to do another hair transplant. That's why he said he went and got SMP. He said it hurt a lot. He did not get what he expected.
Right.
I think he was a little too young too. That was 8 years ago.
Yep, because his hairline's a little lower than I would have done. But at least it's not one of these goofy straight across hairlines.
Yeah, it looks good on him.
The goofy thing though is, as you probably noticed, is he's got this crazy scar that's only on one half of his head in order to get 800 or 1,100 grafts, whatever he supposedly got. I don't know who was thinking that up, but that we wouldn't do it that way. So now, take a look. We're going right into the middle of his surgery. So I just finished making all the holes, and the girls are starting to put the grafts in. And you were pretty nervous when we were doing this because you said you had a lot of pain at the other place, right?
Oh yeah.
And when I took your strip out, did it hurt you much?
No, the strip was fine.
And you were still feeling a few pokes until I did those little nerve blocks, and then after that, did it pretty painless?
Yeah, it was pretty much painless after that.
Okay. And we were just talking with your wife, who's a nurse, who's getting ready to take a look. You got pretty weak hair, so we're having them cut them just a little chunkier than we'd like to, but nothing like those 2s and 3s that are along your hairline on the right side that I took pictures of. And you just didn't have much on the left side at all. So we'll get this in. And so far, has it been kind of what you expected, or easier, harder?
A little bit easier than my last procedure, so yeah, it's a little better than I expected.
All right. They going in good, Wendy?
Yes.
So, you're putting the hair in. We had him cut them a little fatter because they're
Yes,
such
because
weak
the
hair.
technician said that the hairs were like very weak, so we had him put it more.
A little more dirt around that root.
Yeah.
Yep. And I think that might be another different thing that makes this a little more successful than his first one, is being a little more careful. And,
Yeah, because
we don't run a production house. We, if you need a little bit something else done, we tailor it to fit
yes.
you.
Mm-hmm.
And he says it doesn't hurt much. And we did 141 strip cases last year, and I can think of 3 guys that said it hurt a whole lot, and 138 guys that said exactly what this guy is. So it's pretty typical. So now let's go to the end of the case. So, Michael, we just finished 2,450 grafts exactly. Mm-hmm. Cut out your old scar. I told you had a little bit of a doughy head, and your hair's kind of weak, so we cut them a little bit chunky.
Right.
How much did I hurt you today? Be honest.
Initially I felt a couple pricks, but after that it was smooth sailing. No pain at all.
And again, don't say where you went before, but by and large, did I hurt you less than or more than where you went before?
Much less. It was definitely a much better process throughout the whole thing.
And interestingly, we just had a patient come in that came from the same area that you came from and was going to go there for an evaluation, so you got to tell him your side of the story there.
Yeah. I'm glad I saved him. I wish someone could have saved me.
Yeah.
I did enough research now.
Anything you think that the viewers of this would want to know? So up front with you, kind of bullish.
Honestly, Dr. Lindsey is straightforward. So, I mean, if you want it sugar-coated, don't come here.
Right.
That's the truth. But, he will. I mean, as far as I'm concerned, he's definitely...
You'll know what you're going to get.
Yep. Yeah, he gave me what I wanted, and so far it's been everything.
And the only tricky thing was that you'd had SMP, and so initially when I first saw you, I thought we were going to get like 2,800 grafts, and then today I thought, my gosh, we might get 22, and it turned out we got exactly 2,450, which was right close to the 25 I thought you needed. So
exactly, and like you said, I had SMP and I had a procedure before this, so it was a little more difficult than your virgin head.
This should work. I want it to work almost as much as you do. All right, so stay in touch. So, you got them packed in there nicely.
Yes.
I expect this to turn out well. There are a few spots where there aren't any hairs.
Well, that's where he had hair, the transplanted hair before.
Right. And so you called him today. Today's his 3rd day out from surgery. He lives out of state.
He's doing well.
Yep.
Yeah. There's just a little sore in the back.
Yep.
Each corners. And that's what we expect. So,
we'll hopefully see him back in a year. We did this from here to here. Like a lot of young guys, he's got this crossbar. And so we just had a guy call and inquire about when do we do a curve towards the back of what we did first. He's got this crossbar, so we went straight back to this. When that goes away, we'll start there and work back and then do a kind of a natural appearing curve where we finish the hair transplant. And then, so he's a young guy that did this. So take a look at this next guy.
That would have been his future if he would have not.
This guy went to a similar organization and had a few hairs sprinkled in the front and a few hairs sprinkled in the back. And look at him bent over. He's got exactly the same head as the kid we just fixed. He's just, on one hand, he's better because he's got brown skin and that brown stringy hair matches. On the other hand, he wasted a bunch of hair. He put these 500 mini grafts he's got in the back are wasted. Yeah. So we trimmed him down and packed the whole front 25% of his head, and hopefully he'll look significantly better 12 and a half months from now. He's 4 days ahead of this first guy.
So if you see the guy before, he has this thinning, and then the crown starts, the bar is good. And I think this patient, that's what happened too. That's what he had going on too. Front, and then here. And then you see here, he had I think at least 500 mini grafts, which is like 4s and 5s and things. So we could have you, if he didn't not make the mistake of putting them here, because it really doesn't make any...
It's not enough.
It's not enough change at all. Those would have been great to put it right in his bar and his next one.
Yeah. So in summary, do your research. Equally importantly, don't get talked into somebody by putting a little bit here and a little bit there and a little bit there, because it's never enough. So to conclude, just do your research, and if Wendy and I can help you, please give us a call. Thanks.